what is said in group stays within our group. We recognize the fact that folks do not feel comfortable talking in front of large groups, and that's perfectly all right. We're okay with that. But we will break out into smaller groups later on if you so wish. Or we can make arrangements later on to have in-person discussions and stuff. Therefore, one-to-one in-person can be made arrangements for after the meeting. We all ask all participants to be mindful during our Q&A sessions and be mindful of your time so everyone has the opportunity to share. Myself, I am a healthcare professional. I am a registered nurse. But we're still limited in answering people's questions. And we all have similar stories, but each story is an individual as a person that's telling the story. We encourage participants to discuss personal health concerns and needs with your healthcare team and your doctor. But we're there to give you support and, we're there to give you extra support. Do insurance coverage. We do not provide, promote, or any product over the other. And it's as individual as a person that is going through the, like with their own health. Okay, now at first when we did this presentation, our son Scott and our daughter Heather kind of helped me with it. And the sound quality wasn't the best, so James and I are going to do this again here. This is a personal disclosure, and I do this because I feel it's important for people to know where I'm kind of coming from. I do not have any ties with big pharma or large corporations. I remain within excellent standing with the Saskatchewan College of Registered Nurses. When I advocate or represent those who I'm professionally associated with, I do use my signature, which reflects my status of registered nurse, and I have my adult certificate in education training. I do sit on this board, and I also sit on the Prostate Cancer Support Canada's National Council as a Saskatchewan representative. I do have a mantra, and before we get into this discussion, you're going to notice throughout this presentation, it is going to make reference to COVID. Please do not get stuck on the word COVID. It's like the other C word, cancer. And everyone is a little sensitive about those two words, and please just, this has to do with any form of infection or any form of disease or disease process. As a registered nurse, I follow a code of ethics, and this is my personal mantra. I believe in giving safe, competent, compassionate, and ethical care. I believe in promoting health and well-being, promoting and respecting informed decision-making. I honor dignity. I maintain privacy and confidentiality, and I believe in promoting justice and being accountable for our own actions. Okay, now, if you notice, this is our little zebra. A zebra doesn't necessarily always mean that it truly is a zebra. It's like, it's a duck. Is a duck a duck? No, not necessarily so. Something may present in one fashion, but it may come off as something else. And this is basically what happened through all the COVID years. Somehow they kind of lost their way, and they had everything set up in regards to pandemic, but somehow they lost their way. I don't know how they lost their way. It just happened. So therefore, with nursing, it's a delicate blending of art and science. It's compassion, empathy, and I believe in evidence-based and consistent standards of holistic care. Science should always be questioned, and peer review must always be taken into consideration. Now, each of you in this room, you are your own expert. You know your bodies better than anyone else. So do not be shy in advocating for yourself, and this is where the support group is here to give you guidance and help with, is to help you promote your own self-awareness and to empower you in your own advocating. Okay, now, as I think it was Jeff that mentioned that he saw these numbers. Now, all of this information I had gotten off of the Saskatchewan government site and also the federal government site, but also I always like to use cross-reference with other sites as well. And I believe in going with reputable sites. So I'm going to be showing that at the very end. I will not discuss it. We'll just go through it. So this is the where I've gotten this information. Now, when you stay home, yes, Jeff, if you are sick, you stay home. That's the number one thing. And this is only common sense. If you're not feeling well, stay home. Take care of yourself. Hygiene manners. Where do we forget to our simple hygiene? At one point in time, we used to cover our coughs. We would have a tissue. We wouldn't cough into the atmosphere. We'd wash our hands. You know, just common sense. Use proper precautions in the correct fashion and during the specific situations or applications that you use it in. Now, I do have a sheet here in regards to your own personal health history, and I'm going to pass it around and everyone can kind of take a look at it. You can find that on the government website. Take a gander at it. Like I said, you're your own expert. You can figure out where you're at, but I'm going to go through certain snippets of this whole process. Hygiene, I'd mentioned, I'm going to be discussing that. Vaccinations, also discussing that. These are some of the objectives. Ventilation, which we've simply forgotten all about, is what is ventilation, and PPE, the proper use of PPE. And if you're a nurse like me, it drives me absolutely bonkers when I see someone using PPE. Yeah, or a clinical quality. Oh, I trained the doctors how to use your PPE. So it just drives me bonkers when I see people not using things correctly. Okay, hygiene. Okay, we're going to do this. And if you want to use the bottles in front of you, you can, but simply hand washing. And believe it or not, I had to take a class to train and teach this stuff. Palm to palm. Come on. Palm to palm. Back of hands. Back of hands. Between your fingers. Between your fingers. Thumb. And I'm sorry, I was trained in the OR, so I go thumb, this finger, this finger, this finger, this. And then you make sure you're up here and here. Fingers, fingers, nail beds, nail beds, nail bed, nail bed. There you go. Simple. 1, 2, 3. Yeah, there you go. And then wipe them on your jeans. There you go. So that's basic in any form of hygiene. Vaccinations. Now, we know that there has been a hell of a lot out there in regards to mRNA vaccines. I found out it's actually called gene therapy, and I don't know where they get the vaccine part, but it's actually a form of gene therapy that I did all my research, and this is what they're referring it to. Somehow it got labeled as vaccines, which is inaccurate. So therefore, there's other options that you can look at. Your flu vaccine. If you do not have any problems taking vaccines or vaccinations or have any trouble with how the present vaccines are made, and always consult with your doctor as well, please always consider your yearly flu vaccine. It changes from year to year. Your pneumo or your pneumonia vaccine. There's also your shingles or your zoster, your hepatitis or Twinx, and there's your, oh, I love this, Ducrol. That is my God savior in Mexico. Ducrol, it does help. And that does kind of help you in certain circumstances when you are traveling. Yes, Jeff.
So the Shinrex versus the zoster. I know I think I got the Shinrex initially.
Yeah.
But the light zoster one is more, is it better?
It's better because it covers more of a base. I know.
The newer one is the better one. It's got a 90% efficacy or something,
Yes.
whereas the older one is, when I had it done, it was 50%
Yeah.
efficacy.
Yeah. And Boyd has,
About the Shingrix?
yeah, Shingrix, yeah.
The newer one.
Yeah.
It's the newer one.
Yeah. So, but look at what's best for you, okay?
Get the zoster after the Shinrex?
Mine was the other way around.
Yeah, because the other
Whatever
one's,
the new one is.
yeah, the Shingrix is
It's
new.
okay to get the new one if you have the old one?
Yes.
Yeah.
Yeah. Because the old one, the old one dies off after 2 or 3 years. It's sort of kind of,
Oh, that was 10 years ago.
same.
And now also with vaccinations, and this has come out through public health you no longer need to have boosters, but there's certain circumstances with the COVID vaccine that where you should have a booster. And I'm going to get right to the back page. It's recommended for Canadians under the age, no, it is recommendations excludes Canadians under the age of 65, as long as that person does not have a complex medical need or live in a long-term care facility. Booster shots are for at-risk people, and we're going to discuss at-risk in a moment as well. Dr. Tam has said that the general population has a high level of antibodies resulting from the vaccination and from having COVID. That does build up your own natural immune system. Now, I do apologize, the date on this is February 2023, but this is the, over 90% of Canadians have had the vaccine, at least one shot. So, you know, when you go out there, that one shot is out there in someone's arm, and, you know, it does provide some sort of immunity and protection. Okay, factor in prevention. Now, this is HVAC and ventilation. Now, if you see this room, this is an old-fashioned tuberculosis room. Right, James? He has had family that have gone through the old TB center in Fort Saint. And there was a reason, even in the old general and in the Pasco Hospital, they used to have the open rooms. 3 sides was windows, they opened up. They put them out in like 40 below weather, your TB persons, but it was the ventilation, the cross ventilation. It had a high sun, and of course that's vitamin D and the fresh air. And that was one of the best ways for them to treat TB at that point in time. So stop and think. I'm not just talking about COVID or anything else. I'm talking about other diseases as well, and where you stand in regards to that risk factor. Now HVAC, now in acute care settings, and I had, as I had mentioned with that first picture about the old TV room, but in the new hospitals, they have a positive and a negative air pressure in the isolation rooms. And it depends upon what the person comes in, what type of illness or whatever, they will gauge that isolation room. Now, if you have a person, and recently my sister-in-law was diagnosed with leukemia, and they're going to be, decreasing her immune system so that she can have a T-cell transplant. So they're going to wipe out her own immune system. She will have to be in a protective environment. Her white cell count is going to be zilch. So there's a reason behind that. So for us at home, simply like a filtration system, a HEPA filtration system, even something on your furnace or something like that. Opening up your windows. I know the heating costs are atrocious, but the fresh air is essential. Now, especially with COVID, COVID is a droplet infection or a contact droplet infection, which means it thrives in humidity. So, and why I have the example here for an operating room is operating rooms will actually close down if the humidex is above a certain number. And our daughter works in the OR, and she says it was fairly low. I thought it was higher than, yeah, I think like 27% or something like that, which is fairly low. But I remember in the old days, when they would close down the OR if it was above a certain temperature, if the humidex was high. And I remember them doing that. I'm an old nurse. Now, I'm not going to go through any of this. I believe I'm going to go through it so that people, and so that the report, it does record this. What's that? Looks good. It's Lisa. Thank you, Lisa. Okay. Now, growth of infections. And this piece is, I just mentioned about being a nurse and wearing masks. This piece is very important for people to understand. Growth of infections. Infections need a certain environment to grow in. It has to be warm, has to be dark, damp, wet, and they need time to grow. So if you remember our principles in nursing, that's just basic, best practice, and those are basic principles that we have in nursing. Now, this piece is important for mask use. And this is looking at mask use closely. Now, this is your regular surgical mask here. You notice the filtration, the outer and the inner, the filter. This is a polyurethane. I don't know what a polyurethane mask is. This is a study, pardon me?
Plastic.
Is it plastic? This is a study that was done in Japan, so they may have different products than us. And this is a simple cloth mask, and you see the weave. Now, if you see this grid system, I want you to take note of that. That grid system is this grid system right through here. Now, a non-woven or the blue mask is used for infection, and the polyurethane is for like hay fever, and I'll show that. And the gauze is for a different type of infection, and I'll break it down here in a minute. Pollen is your hay fever. Yeast infection, bacteria. If you notice the grid system here, that is 5 UMs. And a UM, I've got it written down here, is a micrometer, SI, 1 millionth of a meter. Micron. I've got it kind of scratched out here. Or 1,000th of a millimeter. So there you go. And that just kind of shows the size of that. Now, if you notice this, a droplet, which is contact droplet, and a virus. The virus will be inside the contact droplet. So what happens? What are the principles behind a mask getting wet? If it gets wet, it bleeds through. And whatever your bug is going to bleed through as well. Okay, another thing I wanted to point out, and why I kind of brought this up as well, is one of my recent nursing journals, they had noticed that there was a significantly high rate of yeast infections occurring. And I don't know why that's happening, but I kind of popped this in here so that we had it bigger so that we understood. Fungal, the size, and you'll see 0.2, this is 5. Aerosol is 5, so that's about the size of that. Now, fungal spore is 2 to 50, and a different type of fungal, and pollen is rather large. So we know that it will help with pollen. But with fungals, I've noticed that fungal infections, but this is going to surprise you. Where are these infections growing? Believe it or not, on the face side of your mask. The side that's closest to your face. After 1 day, they've noticed that with all masks, 1 day growth, 2nd day, about the same amount, and the 3rd day, that's when they really notice. So please, dear heaven's sakes, do not reuse your masks. And I'll explain that in a minute. The outer side is pretty well straightforward, but you still don't monkey around with your mask and touch it, but we'll go through that. So that's why I wanted to bring that forward so everyone had a good understanding of that. That's Kaji.
Now, Lorrie,
Yes.
are masks meant to protect others or to protect you? Or me?
Yeah. Well, hey, I've got that question coming.
Oh, good. Okay.
It's coming. You're ahead of
Ahead of your time.
Oh,
you're ahead of
okay.
my time. So when you go to remove your mask, you use the strings to remove it, to take it off your face. Wash your hands before. Take it off, wash your hands after. Dispose of your mask immediately. Do change your mask if it's dirty, damp, damaged. They are only a one-time use. Now, I'm still to this day, I'm still trying to figure out where the government agencies, maybe because there was a shortage, kept saying, keep reusing your mask. We know as nurses that is not recommended. As nurses, in fact, it'll be anywhere from 20-minute use to, it depends upon the mask and the maker and the manufacturer, but you have to be aware of that. When you store your mask, store it in a paper bag, not a plastic bag, not off of your mirror in your car. You store it in a dry paper bag, and when you dispose of it in a plastic bag. Okay, do not touch the paste portion. Never, ever, ever touch the paste portion. Okay, that's contaminating yourself and also the mask. Don't hang it from your ears. Don't use it if it's dirty, damp, or damaged. Don't share your masks. And of course, hanging it off your car mirror. That is my biggest no-no. When not to use a mask for a child under the age of 2, because their airway is no bigger than my pinky finger. If they inhale something, a fiber or anything off of that mask, they will inhale it, it'll go down through the lungs and will choke. On a person who has any significant breathing problems, that may be COPD, emphysema, things like that. You have to be aware of that. On a person who may be impaired, who cannot remove the mask themselves, be they cognitively challenged, be they handicapped physically or mentally, then that's got to be taken into regard as well. Now, they are recommended, and we're getting into your question here. Are you ready? Masks. Now, this is for someone who tests positive or has symptoms of COVID. Now, go back to that other slide where we had a high rate of our people vaccinated. So we're okay with that. And later on in this presentation, I'll explain why that is. For someone who is caring for a person who has tested positive or has symptoms of COVID. Now, I'm going to be straightforward with you. What are symptoms of COVID? It is so wide ranging, we don't know anymore because it covers everything. People who live in an overcrowded setting or with someone who tested positive or has the symptoms of COVID. Now, but also please, if someone is sick with other illnesses too, take that into a regard. If your health is vulnerable. Now, like my sister-in-law, her white counts are going to be in her shoes and her boots. She is vulnerable. This is a vulnerable person. If you are in contact with someone who has vulnerable health. Now, remember, anyone over the age of 65 in a long-term facility, that is, or someone who cannot wear PPE. Okay, we've got a chat here. Let's see what this says. Sounds fine. Oh, good. Okay, audio's good. Now, and I recently saw this today when someone was being unkind with another person. Performing your own risk assessment when you're wearing a mask. Now, Boyd and I ride motorcycles. Before I jump onto my motorcycle, I do my own personal risk assessment. I don't like riding it in the rain. Don't like riding it in the cold. And
8 miles on.
yeah, no, we don't put many miles, and it depends upon how long we have to ride and stuff like that. But this is what you should do for yourself as well. You know yourself. And for those that are around you, long-term care home, you assess your own risks. And this is the same of any venue or business. Be kind, be respectful. And today I saw a woman berating a friend of ours because she was standing close to her and she was wearing a mask. And, it's sad. I know it's just sad. I can't say anything else. We have to be kind to each other. Now, believe it or not, all this information is intended for the general public and not for occupational health and safety. And I have a health and safety or occupational health and safety with the hospital. I believe if you have standards, you don't have two-tiered standards. If you have standards for one, you have standards for others. This is why this is so important, why I felt it was important for you to learn this today, because believe a lot of this would not be shared, and I believe it should be. This is where all these slides have come from. Now, healthcare professionals, now, Bittrex. You know what I'm talking about with the Bittrex, where they do the fitting of the mask and they put the hood up. Oh, God. Well, I thought it was if you smelt it. Yeah. You taste it, but it's a very bitter. And in a healthcare setting, we are actually fitted. And I forgot I had my mask and everything. I forgot them at home to bring, but I actually have a hospital grade N95. If you have any concerns about your mask, do the smell test or do the taste test. Spray it in the atmosphere, see if you can smell it. If you taste it, I don't know, what can we put in there? I don't know, methane, I don't know. Like, not methane, but you know, something that, you know, kind of really kind of heightens your,
Cannabis.
yeah, oh
A
my.
good cannabis with
Oh.
terpenes.
Oh my gosh,
You
there,
get a bunch of-
you're back in the day here. Okay, so now James had brought this out. What type of mask is really quite effective? And to be quite straightforward with you, the only mask that I feel comfortable with is an N95. And I will go through this as well. Back in the day, we used to have cloth masks. We don't have them anymore, and there's a reason we don't have cloth masks, because we used to have the green, the big, thick, kind of that color of cloth mask. There's a reason, yeah, OR green. They're not effective. They do not work. And the medical mask is more or less to stop the spread, but it still vents out. Those bugs still have to vent out, and it has to. There's a reason for that.
So the way I'm interpreting what you're saying is that if I want to protect myself, wear an N95.
N95.
If I want to protect others, if I'm sick, wear a medical mask.
A medical mask, but
Or
in-
don't go out.
However, when we're preparing for this, I went around checking pharmacies and reading the boxes while I'm asking that. I couldn't find any of those, like the regular masks that everybody's wearing. They're not designed for viruses. It says right on them.
Yeah.
So
Yeah.
I couldn't find one other, like the N95s were, but all the other masks that everybody's wearing, I couldn't find one box anywhere in any pharmacy that was for viruses. They're all
Yeah.
for bacteria.
because remember
So-
that gauge, it's
Yeah,
like a
yeah.
mosquito going through
Yeah.
a
Chain link
fence.
yeah.
So now this is why in 95s, and I'm going to leave this slide up a little bit so that if you want to take the product numbers down, you can. If you know someone who is at high risk, but stop and think, if you're wearing an N95, the other person's wearing an N95, you're both protected, right?
So I wear an N95 in my shop when I'm sanding.
Yeah.
Uh, Or when I'm using drywall compound and I'm sanding,
Yeah.
I use a respirator with an N95
Yeah.
quality mask. But that's just for dust control.
Well, and also our son is actually hazmat trained, and like the full garb, you know, like you see on TV where they have the hood and the O2 tanks and all that. That is his level of education. So if anyone wants this, that's
The
the
kind of rule
numbers.
of thumb that I go by is that an N95 protects the wearer, not the
Yes,
public.
exactly. But stop and think. If you're wearing one, you're wearing one, and you're in an environment where someone is at high risk, it's more effective.
So what is a KN95?
Oh, that is a newer one from what I understand. Let's see if they have it on here. That is a new one, and
Made in Korea. No, I
well,
don't.
probably that's a tough one.
More economical.
Yes, because they have the TC here. They have the CSA. Oh, it almost sounds like a radio channel, Z94.5 or 4. And then a K, but I don't have. I have the K94. I have the KN95. So-
95 would be more.
And yeah, and I think that's the one it takes up more particulates, if I remember
But the
correctly.
KN, like, those were the ones that were available to purchase retail for non-medical people.
Yeah,
during
And it's on
COVID.
here. They've got it on here. So it does meet standards. So that's one of the good ones. The KF94 is also another good one here as well.
It meets standards if it's properly marked as meeting standards. Yeah.
Yes, yeah, and always read the box.
Otherwise,
Oh,
it's as good as a handkerchief.
yeah, yeah,
Slightly
Yeah,
better. but
yeah.
Slightly better.
yeah. Well, and I did have a demonstration of a box of used Kleenexes, and as I was gathering all these Kleenexes, my grandson started using them, and I thought, no, why are there used ones? But stop and think, you know, if you have a dirty mask, that's the same as a used Kleenex or a used hanky. And I remember my grandfather's hankies, you know, right? Those polka dotted guys in blue and red, and one for each day. Oh,
I remember this back then.
yeah, bandana. But now with this, and I wanted to point this out with the medical mask, it's a typical single use, but maybe reuse. Remember, reuse. This is just for the general public. I still do not feel comfortable with that. Personally, that's my personal opinion. And the reason why they told people to reuse them at the beginning was because they had a shortage, supply issue.
So I saw people even last year just wearing a face mask, but no, I mean the clear
Like a
visor, like a
Yeah.
visor, but without a mask on. And some of them were just visors that were open to the side, but they were clear. You
Yeah.
could see their,
So reflectors, well, it is.
Yeah.
but are
Which is
those
what it is,
effective?
Well, but you stop and think, like I
It's
use,
open,
yeah,
open, right?
yeah, because I have a medical issue like with masks. And I had like the clear visor that sat in my chin. But there's
Those are more for protection from splatter.
Splatter.
splatter and stuff like that. But you stop and think, and also they had mentioned that spitting. I think it's that it's you spitting any of the particulates out there. So, and it's going on the mask. And so I used it for me so that I wasn't splattered, or I think speak moistly. I think that's what Mr. Trudeau called it.
Anything that comes.
Yeah. But for this type of mask, and here is the box label, and this is what they recommend. Okay, cloth mask, I'm not even gonna go there.
Yeah.
Not even gonna go there.
Move on.
Yep. COVID-19, I'm gonna go through this. I'm not gonna even discuss this because I've already discussed this previously. This is off of their national website, and this
That's
is where
really
it says, this advice is intended for general public and not intended for occupational health purposes. It's on there. That's a government website.
Mhm.
This is also, I'm going to go through this. This is basically what I've discussed. Again, their disclaimer.
Mhm.
Now, this is the risk assessment that I passed around. I'm just going to go through it. We're not going to discuss it because we've already discussed this piece. The points that you see there are all the points that I've discussed, and I wanted you to see that I actually had the reference piece here.
I like that you're going over this again, and I'm picking other stuff up in it,
Yep.
but one of the reasons why we're meeting here, we're not meeting for the cancer agency, is that only 6 people can be in that
Yeah.
room without a mask, and they have to be socially distant. And if you have more than that, you have to all be masked.
Yeah.
That's their policy still.
Yeah.
Their staff and whatnot are still masked in that building. So every employer is a little different.
Even that, you go to different pharmacies, like
Yeah.
I've been to different shopper pharmacies, go to one, nobody's wearing a mask.
Yeah.
Next one, everybody is, so
You know, depends.
it's almost like an individual.
Okay, so now this is going to put things in perspective and to kind of close things up tonight. And I like this. This is serious. This is the sun, the earth. That's kind of, what's that?
Satellite radio.
That's right, it is. Oh, he's got a fizzer. Okay, now I am not a stats person. James is a stats person. And I had our kids help me with this because they're their statisticians. But this information all came off of the national website or the common domain. And this is all the information that the WHO, CDC, Mayo Clinic, Johns Hopkins, they all input their information into this website. They will be discussing case fatality rate, infection fatality, crude mortality, or crude death rate. Now, with this,
Canada also has that information for Canada.
yes,
Statistics Canada also has a COVID site that gives you the same information for Canada.
and this is the world site. So I'm not going to go over that. Like I say, I'm the worst mathematician. Thank goodness I've got fellows around me that do this. But I want you to understand in the media and they. When I worked with clinical quality and professional practice, I had upper management wanting me to scare the shit out of staff into reality. And I told them that I would never do that. I believe in informed consent. And the media, or God only knows, believes in trying to scare people. I don't know why, or whomever it is. But this came off of the website and said, unfortunately, journalists sometimes suggest that a case fatality rate. Now, case fatality is the number of confirmed deaths divided by the number of diagnosed or confirmed cases. Okay. It is important to note the ratio between the confirmed deaths of the disease and the confirmed cases, not the total cases. Have you kept up with me so far? Okay. Yeah, you get this figured out for me. Now, infection fatality rate is a number of deaths from the disease divided by the total number. So the infection fatality rate, and you've got the ratios there. Now, if someone is infected from the disease, how likely will they die from it? If the total number of cases is unknown, you cannot just calculate it from the observed cases. It has to be confirmed. And researchers then estimate the total number of cases.
But here's the challenge. Here's the challenge with COVID data in Canada. With the exceptions of Manitoba and Quebec, they're the only ones that did post-mortem testing for people that died. So every other province did not test people who died for COVID. So our COVID death rates are underreported because they are tested. And as well, when we moved from PCR testing to rapid antigen testing at home, at one time you had to report to public health and then all that stopped. So we really didn't know the true numbers of infections in the province.
Yeah.
And that all changed about February of 2022. When all those, when the mandatory vaccination policy was lifted.
Yeah. And even the matter of the PCR testing, because it just measures the protein. It's not, it should not be used as a diagnostic tool. For you to have a clear diagnostics, you should culture, use a culture and sensitivity. You should grow that bug to see. This shows you you have that protein or the antigen in your body. Do you have something?
Well, the PCR is a little different than an antigen, right? So
Yes,
you're right
it's
about
pure
a
different.
protein, but the antigen is a little different. So the PCR is an amplified test, extremely sensitive, and so is the rapid antigen. The problem with rapid antigen it has a higher degree of false negatives.
Mm-hmm.
So that's my understanding.
Yeah, and the higher you replicate, the more error for false negatives as well with the PCR. So yeah.
Both positive or both negative?
Well,
The PCR is very accurate actually when it comes to false negatives and false positives. So it's not the same as the rat test. The rat test, if you have a positive rat test, extremely sensitive and it's very accurate, but a negative test is not as sensitive.
Yeah. Okay. Now this is where it talks about the case fatality rate. And where what James and I have been discussing is your case fatality rate is much higher. You have higher numbers. They believe there are far more people out there that do have COVID, but they're not demonstrating it. They're not shedding the virus. Now, overestimated is what we were talking about. We believe more people went undiagnosed with COVID, and we've already discussed that between James and I. So the total number of cases is higher than the total number of confirmed cases. More numbers of undiagnosed are not counted. Your probability of dying from the disease is lower. And in the previous slide, I had a lot of them referred to it like the Spanish flu, but there's major differences there too. Now with this, it goes 10 deaths out of 100 cases equals 10%. So therefore, if the actual number was 500 undiagnosed, therefore 400 cases were missed, where it drops it down to 2%. So now you put that in there with the number of our vaccinated people and look at your own personal risk factor, put these pieces together. Now, this is like the world view. If you notice here, that purple, that was Italy. And the reason for that, and I want you to step back a bit in a minute and think, with Italy, why they had such a high death rate was because they had a high elderly population in a very crowded country.
very,
Okay.
very community and family based as
Yes,
well. So
yes,
they do a lot of things in common.
yes. No, this is a different screen just to show you so that you can see it a little bit better. Canada, we're kind of sitting at 1.11. And US is 1.9. So,
Very similar.
and there we go. And there's Canada throughout the world where we're kind of sitting. And that was as of March of 2023. So I tried to keep this updated, but you know,
But that's the case fatality rate, which was actually, if you.
case
if you don't-
fatality rate. Yeah.
Yeah,
And remember, the case fatality rate isn't always accurate.
Right.
Yeah. Now, if you notice, this is the number of confirmed cases, and there's a spike here in March. If you notice a spike, that is during Omicron and Delta. So
Delta was earlier.
was it earlier?
It started and they started talking about Delta in February and March.
Yeah.
In 21, and it peaked.
Oh, this is 2022.
because the
Sorry
Omicron
about that.
is in 2022.
Yeah, this is
I know, but
2022.
Omicron was started to raise its ugly head when they started shipping people out to Ontario, which was
Yeah.
in September, October.
The Delta and Omicron.
That's right.
And Boyd and I both survived Omicron.
I was sick for it.
Yeah, yeah. But we were vaccinated. We had 4 vaccines in us. So, hey, you know, at least we didn't die.
Well, how many people here actually had COVID?
And new.
Yeah.
I knew about it, yeah, that were confirmed to the rat test, yeah.
Now with this one, and please take this in the context that I'm demonstrating it. This is the cumulative confirmed COVID cases and deaths in Canada. As far as I'm concerned, any death is still a death. That's the same as cancer is cancer. In Canada, around 1% of the death rate. Cumulative confirmed cases was over 4 million. It's still a death. And no matter what we say or do, it still
So
matters.
they say cumulative, is that from other comorbidities or what?
You know, that's a
No,
question.
no, it means that it's cumulative means from the beginning of them tracking.
Yeah.
It's all the deaths from the very beginning of when we started
Is it-
testing.
It's a gross total.
That's an incident, usually looks at rates of infection at a point in time.
So that's cases and death, not 4 million deaths.
No.
4 million people had COVID.
This is
Over the length, and those would be including
Sure.
cases that had repeated, like there's some people who've been infected with COVID more than once.
Yeah.
So
Yeah.
they would be counted more than once in this.
Oh, so each one of you, one confirmed
Case, and it could be the same person or different people.
now I threw this in there. It's just a different graph. It just demonstrates it in a different fashion. Okay, now remember I talked about Italy, and with the CFR.
case.
Thank you. I was having a brain pain. Case fatality rate, it also changes with the disease and the disease process. Now, commentators, when I say commentators, are talking about the media again. When they look at the case fatality rate, it isn't a single steady number. It's always flexing. It's always changing. And the same with the disease. It's always flexing. It's always changing. You have to take that in relationship with the environment it's in. If you have some place like Italy, if you have some place like China, if you have a place where they have, India is another prime example,
Care home.
a care home, a place where there's a lot of family members living close together. You could have several people in that home infected or sick, but it depends upon each person, how, you know, their immune system and everything works out. And this is basically what this just talks about. Just doesn't depend upon the disease, but it also depends upon the treatment they're receiving. Now, at the beginning, from what I understand, and this is this is hearsay. I don't have anything to back it up, but they were told that do not treat the person. I'm thinking, well, what do you do? Like, you know, like, they had some ideas on how they could treat the people, but yet they said, don't treat them. And I'm thinking, well, why not? But in different environments, in different places, they did treat people in a fashion they found certain things did work and certain things didn't. Again, location and characteristic of the age, sex, this goes with Italy and all those places. Now this tells you location, and this is at the beginning of COVID, and this is in China, in Wuhan. And if you notice, this is all in China, but there's different cities and the different locations. From what I understand, in Wuhan, that was where patient 0 was supposed to be from. But also that population had a high elderly population living in a densely populated environment, and also poorer conditions. There's a number of factors there, but they have the other cities there as well. A number of the men or people that passed away were men, not women, and they were smokers. That was originally what they had seen in that case.
In Saskatchewan, it's interesting. I just finished a report, but in Saskatchewan, in the fatality rate was about 10 per 100,000 in February of 2021. But as of December of 2022, it was 194 per 100,000. And it just shows how different points in time it's cumulative, right? But it also indicates the response of how this is spreading to the population. So the challenge there is that more people died in 2022 from COVID than in 2021 in Saskatchewan. And the sad reality is that there's still about more than I think it's about 20 to 27 people every month are dying from COVID still. So it's just an ongoing thing that is continuing to affect people, and some people more seriously than
But you also have the comorbidities up too.
It's true. So comorbidities is an issue there.
Yeah.
At the same time, though, it also depends on how you count it. So if somebody dies with prostate cancer, do you die from prostate cancer?
Not necessarily.
Not necessarily. So the same thing with COVID, right? So it all depends on how you interpret.
Yeah, exactly, and how you look at the whole picture. Okay, now this is all the other diseases, and our son worked in the ER when they had the SARS-CoV, and you'll see this is their case fatality rate, which was 10%. MERS, I think it was MERS, wasn't it? Yeah, MERS, and that was 34. Seasonal flu and Ebola. Well, hello, Ebola. Hello, 50% is death rate. So that's a pretty nasty one. Now, I wanted to kind of close it off with COVID and the difference. COVID is basically a corona or a cold virus. It is more lethal for the elderly based on the Chinese evidence originally when they had that evidence come out. It is now the reason why it kind of settled out so much nicer is because they were sharing information much better with COVID. Now with the Spanish flu back in the 1900s, I think my grandmother was just going into nursing school. It was an influenza virus. It affected the young and the infants, and because those in poor health. Also, countries suppressed the information. They didn't want to release information. But also back then, it took a long time for information to go from country to country. With COVID, there's faster travel times, whereas with the Spanish flu, it took you a longer time to travel from country to country. It was also post-World War I conditions. Nowadays, our improved overall global health is much better. Conditions, diet, medications, hygiene, sanitation, housing, and resources are all much better. And back then, secondary bacterial infections killed people rather than the infection itself.
So one of the other things I'm going to point here, it was called the Spanish flu. It was very fascinating. Ironic that it actually was traced to some farm in the Midwest USA, but the Spanish were blamed for the flu because of Spanish. Remember President Trump, he talked about the Chinese flu, same idea, right? So that's one of the big differences I see as well. It's even
Yeah.
how you name something.
It's a hog farm in Kansas.
There you go. I thought it was,
And
I thought it
poor
was
Spanish
dairy.
people had the highest infection and mortality rate of any country in Europe, and that's why they got the
Spanish.
name for it.
Yeah.
They were
All
the
right.
most victimized.
Now, some of you know these pictures, and don't you give them the answer yet. I know you know this.
I don't know anything.
Oh, bull, okay. But anyhow, what are these things right here? Pictures, I know they're pictures.
Look at the names.
Yeah. Well, hey, this is pretty straightforward.
Bacteria.
Fungus.
They're
That's
fungi.
fungi. This is bacterium. Now, this is what's growing in masks, on the face side of your masks. It's this type of fungus. Remember my recent nursing journal? And this is also growing inside your masks. Where are some of these bugs from? I'm going to go through here. Not China. Jesus, it's from the environment, certain parts of the environment, human genitalia, human intestine, that means E. coli, your skin, Staph aureus, some is unknown, some is the dirt and things like that. Where's another one that I thought was kind of interesting? Now, some of this stuff is growing, remember, on the inside of your mask, but not as more virulent on the inside as opposed to the outside. Ta-da!
Thank you, Lorrie.
And I'm just going to go through this so that we have it on record, and then it can, because this is this is where I get all the information from. And this is just for those at home, and because this has to be disclosed with this information as the references. Thank you very much.